Ladies and gentlemen, hello. I'm called Annick MBABAJENDE and I'm going to give a presentation on the evolution of health services, quality in developing countries. I'm also going to give different challenges that healthcare system is facing, and also I will also give a call of improvement or a call to action. Welcome to my presentation. Starting by the evolution of health services quality in healthcare in developing countries. About 25 years ago, the healthcare system was in hands of foreigners, where where there were different non-governmental organizations which were emphasizing on the healing or on providing different services related to health to citizens. uh, Citizens were likely to use traditional African healing methods. They were not attending or going to the hospital or to the modern health settings. The costs were very high, and also there were no insurance companies to cover different expenses related to health for citizens. And also many diseases were not controllable, such as measles and different other communicable and non-communicable disease. And also there were no immunization system, and there were high child mortality rates due to different disease that the kids were suffering from. And also there were very high birth rate, and also there were no policies to improve the quality of services. But as time goes, there was the inauguration of modern treatment methods and the sensitization of these methods, where now people are going to the hospital in case they feel like they are sick. Also, the people are being sensitized on different ways of preventing some communicable and non-communicable diseases. People are aware of immunization. They go to immunize their babies. And also malaria and HIV rate is decreasing. There were different insurance companies which are offering the coverage of different health services to people. And also the distance from home to the hospital, like different governments are trying to reduce that distance. For instance, in Rwanda, people are encouraged to live in imidugudu, where they can easily access the healthcare services. And also the child mortality rate has decreased because women are encouraged to deliver from the hospitals. Uh, Moving on the second point, which were challenges or risk that patients are experiencing due to lack of the quality of care. There is the death due to errors. Patients they are even developing some other diseases. The time people spend to hospitals, since it's not little time. People are spending on different healthcare settings while they are sick. It can increase the rate of the disease they are having. Also, there is a high cost of different healthcare services where people are not able to afford, and all these can lead to death of the patient. And also the distance from their homes to the hospital, as it is still long, people can reach to the hospital after dying. And also there is no equitability, because some healthcare professionals provide a quality service to people who look nice, and that's how it's not equitable. So this can lead to like can lead to death, or to having other diseases from what they have, and so on. So these are the risks that patients are experiencing due to lack of the quality of care. There are different priorities areas that the governments in developing countries need to emphasize on. The first one is the quality of services, customer care, because it affects the patient psychologically. In case a patient come and you receive him or her nicely in a smiling mood, like it affects the patient psychologically. And also the healthcare professionals should love their job. For example, this can be done through itorero or through different trainings. For example, in Rwanda there is itorero, where different healthcare professionals and even the teachers go for those trainings so that they can love what they do. So this is something that should be emphasized on, helping the healthcare professionals to love their work. And also the costs should be affordable by finding a way of providing different insurance to people. And also they should encourage students to learn healthcare related courses, since like the number of nurses and other healthcare professionals is still low compared to the people who want the services. So as a recommendation, there are different interventions that the stakeholders in healthcare industry should take into consideration for remediation, such as education program, educating people to love their job, educating people to take care of what they do, educating people how they can how they can